Good morning, everyone, and welcome to this Sax Forum on the use of cohort datasets in environmental health research. I'd like to begin by acknowledging the Gadigal people of the Eora Nation and pay my respects to their elders, past, present, and emerging. And I'd also like to express respect for the traditional owners of other lands on which our online participants are located today. Thank you very much for attending. I think we have quite a large number of people online, and I hope you find the session fruitful and maybe even enjoyable. Could we have the next slide, please? Our hope today is to give participants an awareness or an understanding of some important questions in environmental health that could be answered using cohort data, an awareness of potentially available cohort data sets that could be used to answer those sorts of questions, and how to access them. Some methodological approaches and a discussion of the challenges of methods, and an awareness of the availability of expertise in this field and how to access that expertise. As soon as I've finished this introduction, we'll introduce a panel of experts who have very kindly agreed to participate in the session for us, and most of the time of the session will be devoted to the panel. Initially, we'll ask panel members to speak for a few minutes about their own area of expertise, and then we'll have a fairly lengthy period of free discussion in which you're free to, more than welcome, to participate, and then we'll have a few minutes at the end to wrap up. We've scheduled 2 hours for this session. We could finish a little early if we wanted to, but we'll definitely not go on for more than 2 hours. Just a few points about the management of this session. First of all, could you please, as a participant, as distinct from panel member, keep your video off and your microphone off. If you'd like to ask a question or make a comment, could you please use the chat function? And I also would like to let you know that we are recording the session so that we can make it available to others who can't be here today, or you can revisit bits of it if you want to. I'd like to introduce now the moderator for the discussion, who is Dr. Ellie Howes. Ellie is Research Manager and a Senior Research Fellow in the Australian Prevention Partnership Centre, which is administered by the Sax Institute. She's located here with us in the Sax Institute. Ellie.
Thanks, Michael, and hello everyone online. I also would like to acknowledge the Gadigal people of the Eora Nation and pay my respects to elders past and present, and acknowledge that wherever we're located today, we're on Aboriginal land across Australia. When we were talking to the panellists today in preparation for this, we discussed that actually before we get started, it might be good to just go through some terminology so that we're all clear about, and all of you are clear about what it means when we're talking about environmental health, and also different terminology we might use around cohort data and other types of data that we might discuss today. Next slide. In terms of environmental health, many of you, I'm sure, who are joining today are probably very familiar with the concept of environmental health. It's a specific discipline within public health, and it's really focuses on identifying, measuring and addressing environmental risk factors and hazards that cause disease and poor health. And I've listed the sort of the big ones that are under the purview of people like Richard Broome, who's here today from New South Wales Health. But I also wanted to add that, and we all agree that in terms of the panellists, that environmental health is quite interdisciplinary in nature, and it does bring together lots of different disciplines and sectors, not just within health, but also outside health as well. Next slide. But for today's discussion, we're also having a much broader idea about environmental health. We're also thinking about environmental health in terms of chronic disease prevention, which is the space I work in for the Prevention Centre. We're thinking about it in terms of the built environment, such as transport and planning, health economics and economic evaluation of co-benefits of health interventions. There'll be other people today talking about geography and geospatial work, as well as climate change impacts, both in terms of mitigation and adaptation. So it's a pretty broad spectrum that we'll be referring to today when we talk about environmental health. And some of the data terms that the panellists will be using today and that we might be talking about later. Obviously, the main focus of this session is around talking about cohort data, which can also be known as longitudinal data or panel data. But some of our panellists and some of our audience as well, you might refer to other types of data terms such as administrative data, as well as data linkage and opportunities such as that, as well as big data, so your large scale, very large data sets that are really at the forefront now with a lot of data research. So that's what we'll be talking about today, and I look forward to the discussion.
Thanks very much, Ellie. I'd like to introduce you to the panel now and ask each panel member to speak for a few minutes about their particular areas of focus. And we'll go through one by one. So the first is Dr. Richard Broome. Richard is Executive Director in Health Protection New South Wales, which is a statewide health service of New South Wales Health, and Director of Environmental Health. He's a public health physician by background, specialising in epidemiology and environmental health. So Richard.
Thanks, Michael, and thanks, Ellie. And look, I'll just kick off to say that the last couple of years I've actually been almost exclusively doing COVID work. So this is actually a really nice opportunity to get out and talk about something else. But I'm also a little bit rusty, so you might have to bear with me along the way. But I mean, after Ellie's introduction, I don't have a great deal to say. But so I work in New South Wales Health, and we in health protection, and one of our roles our main role is to protect people from infectious disease and environmental hazards. And we do that through our engagement with, particularly in environmental health, with a whole range of other government agencies on things like planning policy, air quality standards, drinking water standards, and then responding to incidents of various sorts, such as heat waves, bushfires, floods, and pollution incidents and contamination incidents, those sorts of things that come up from time to time. And so obviously to do that, we need science and evidence, because the actions that governments might take to address environmental issues will almost invariably come at a cost for somebody. And so if you're going to ask people to bear that cost or impose that on people, you obviously need pretty good evidence. Well, you need evidence of some description to justify that what you're doing. And so this is where the science comes in generally, in cohort studies in particular. And I'll be interested to hear what others say, but I think generally speaking, the thing about cohort studies is they're often the highest level of evidence that we can get in environmental health science. The real power of cohort studies is that they show that health effects, or they can show, if they're well conducted, sufficiently powered, all those sorts of things, they can show that health effects occur in humans at the levels that we actually see in the environment. Often, because we're talking about hazards, you can't do things like randomized control trials, although we have seen one or two done over the years, but they're pretty unusual. But quite often in environmental health, we're actually left using data from animals, for example, so toxicological studies, to make judgments about standard setting and all those sorts of things. And that's actually almost the norm. It's relatively unusual to have good cohort data in humans to base our policies on. But I mean, there's an increasing amount of that, and air pollution is a good example. That's something I've had a lot of interest in over the years, and air pollution is an area, and heat waves is another one, where we actually have human data from cohort studies, and as a result, there's actually been really tremendous progress made in the last 30 or 40 years on air pollution right across the world, particularly in developed countries. So cohort studies are the gold standard, but they can also be quite challenging for use in policy setting, often for technical reasons. So the effects of environmental hazards tend to be quite small, which means that the cohort studies have to be extremely large and go on for a very long time, and consequently cost a great deal of money. So really high quality cohort studies tend to be few and far between, and when they exist, they tend to be used very heavily. And obviously other technical things. I mean, in a cohort study, controlling for confounding is a hugely important issue, and especially in the sorts of cohort studies that are done in environmental health science, that can be an issue. And that is important because when you're setting environmental policies, you're often going up, on the one hand, against big business, and they are powerful and know how to play the game. I mean, what we're trying to do often is say, from a health point of view, is convince ministers that they ought to make changes. And on the other hand, they've got a bunch of other stakeholders who are trying to convince them of the opposite. And big business is very powerful. And I think, just as an example, in the US, they've been regulating air quality for many years, but just in the last 5 or 6 years, I think a theme has emerged where the polluters have cottoned onto the fact that of residual confounding in cohort studies, and they've been pushing that hard. And essentially, there's a school of thought that you really almost can't prove causation with cohort studies. I think we probably debate that, but that's a line that is now being pushed by polluting people in the US, and consequently, the academics and people who are producing the evidence are having to go up against that and are trying to develop new methods to respond in a way that convinces their politicians. And just to mention, on the other hand, you've got environmental advocates who often want to do a great deal more, and I suppose that sometimes it may not be worth, or might not be produce best social outcome to do as much as what an environmental advocate wants to do. So there's the other side of the coin as well. So ultimately, it's often a contested space, and when you have a contested space, it's really important to have the best science you can, and so cohort studies is often that best science that we have. I'll leave it there.
Thank you very much, Richard. Next, I'd like to introduce Associate Professor Melody Ding. Melody is an NHMRC Emerging Leader Fellow and an academic at the Prevention Research Collaboration in the School of Public Health at the University of Sydney. Melody.
Thanks, everyone. Thanks for having me. And earlier we were introduced as the expert panel, and I will call myself the non-expert of the expert panel, because I am not an environmental health researcher. What I'm doing a little bit about myself is to understand in a broad scale what contributes to health and well-being and chronic disease. So generally working chronic disease prevention. So I've been working with cohort data for about 10 years, and what really brought me to the environmental space is that early on, I mean, if I ask you guys today in terms of what facilitates physical activity, which is an example of a research area that I spend a lot of time in, I think you will probably sooner or later bring to the point that the environment really matters, the kind of neighborhoods that people live in. But I might have to tell you, go back, 20, 30 years when we are looking at physical activity research at that time, everything was about motivation, it's about, enjoyment, psychosocial attributes, as if everything is up to the individuals, like whether this person is motivated enough. So I think that is the reason why I started to look into environmental contributors to health. So the way that I use environmental variables, it's often to help me understand what's the underlying patterns of association that I'm looking at. in terms of behavior risk factors, because we often forget about that. Even these days, when we're, in the media or in our academic discussions, we often forget about, we talk about people who have bad diet, we talk about people who live in active lifestyle, we talk about people who don't go to see GP often enough, we talk about people who are obese, as if it's all individual responsibility. So I guess my role is to help unpack that a little bit and go a step further and see what's underlying this association we're seeing here. Do these people live in neighborhoods that are safe enough and walkable enough for them to get to places? Do they live in places where they don't have healthy food outlets? Do they live in places where there's no hospitals or GPs around? So this is kind of helping me go a step further, a step upstream in terms of looking at what contributes to our health and well-being. So this is kind of my grand aspiration in my career. And I think what I want to mention here is that there could be challenges along the way. And I have, been working in this area for a long time, and in terms of research output, it has not been optimal. But there's good things is that I work with some experts actually here on the panel. So it's really teamwork that I don't have to reinvent myself to be an environmental health researcher this way. I could work with people like Jeff and Joe who really help me develop the exposures. The challenge could be the time it takes to acquire data, to really synchronize your research agenda, your calendar in terms of reporting to funding bodies, and the time that it takes to get all data together in the same place in the analyzable format, to get things insured, to get your analysts lined up, hiring all have to happen at the same time. But I guess it's just the kind of typical challenges that we all deal with in our research. I think sometimes we kind of rush into a project with this kind of excitement that we think that this could be done in 1 year, but or 6 months. And I think from my experience, it's a really long-term investment. But in that process, you build great collaboration with people, and then some of the research questions might just take a little bit longer to push out, to really kind of examine it in a more thorough way. And I guess my last take-home message along that line is that cohort data are fantastic, but just like what Richard so eloquently pointed out, that it's one of the best data you can get out there, because it's often quite hard for us to randomly assign people to different environments. But cohort data can also be very tempting, because there's so many exposures that you can imagine you can also derive from external data sources, and there's so many outcomes. And we live in a publish or perish academic world if you're an academic, so it's very tempting for you to say, this exposure is there, this outcome is there, and nobody has looked at it before. How about I just write a paper to fill a major research gap? So I think the environment and lifestyle research in the last decade has really suffered from overpublication. So in terms of physical activity and the environment, I feel like we haven't really moved that much further, despite of thousands of papers being published, because they're primarily cross-sectional, often couldn't take into account of residual confounding, especially with socioeconomic status and other aspects. I really kind of call for all of us not to rush into a paper just because of the exposure that's out there, but step aside and ask yourself what kind of research the policymakers want to hear, what kind of research is really pushing this field forward. And NHMRC is now changing its evaluations of criteria in terms of focusing more on the impact and quality and less on the quantity. And I think that's a really good shift. So yeah, my take-home message: get into cohort, collaborate, and ask the important question, even if it takes a little bit longer to get the output. Thank you.
Thanks very much, Melody. Next, I'd like to introduce Professor Sotiris Vadoulakis. Sotiris is the director of the NHMRC Healthy Environments and Lives Heal National Research Network and Professor of Global Environmental Health at the ANU, the Australian National University. Sotiris.
Thank you very much, Michael. Thank you for having me today, and it's a pleasure to be in this panel. My background comes mainly from air pollution and health research and climate change and health research, mainly in the UK for many years, and more recently here in Australia. As Michael was saying, I'm directing the NHMRC HEAL National Research Network, which is a new initiative funded through the NHMRC 10 million special initiative in human health and environmental change, with many of the colleagues on the panel today involved in this program. And I have a broader interest in environmental health research and climate change. I have a few slides that I would like to share with you, and then I will make some points in relation to the specific topic of today's discussion. I will try to share my screen. So I would like to give you a 3-minute overview of the HEAL network, which I hope will be of interest to many colleagues on the line. So, and first of all, I would like to pay my respects to the traditional custodians of the land, Nunal country, the land I'm based at, and also the Aboriginal and Torres Strait Islander colleagues in the HEAL network and on the line today. And a lot of the Aboriginal and Torres Strait Islander wisdom and knowledge is the inspiration of the HEAL network and the way indigenous communities adapted to environmental change over thousands of years. So this is the cornerstone of the HEAL network and part of our inspiration. The objectives of the network is to take leadership in environmental change and health research, to provide the evidence, capacity and capability and tools, to urgently develop the methodologies, the knowledge, the tools to protect and improve community health, and especially of at-risk populations disproportionately affected by environmental change in rural and remote Australia, but also in urban areas. We aim to strengthen the health system resilience to environmental change, like extreme events, floods, heat waves, bushfires, and also reduce the impact of the environmental health and the public health and healthcare sector to climate change, the footprint of the sector and the carbon emissions of the health sector, and eventually reduce inequalities and inequities within and across communities and generations. So these are the overarching aims and objectives of the network. Some of the key areas of focus are extreme events, like the ones we experienced recently, floods, heat waves, and droughts in other parts of the country, bushfires. So these extreme events that make the headlines and cause immediate health impacts, but also long-term effects on health. We're also looking at the slow-burning issues which might not make the headlines on a daily basis, like air pollution from different sources, and also the overheating, especially in the built environment, which may have effect on health directly, but also on labor productivity and long-term impacts on mental health. We're interested in soil and water contamination and the impacts of legacy contamination, plastic contamination of our soil and waterways. And eventually also we're interested in the distribution of vector-borne diseases and other infectious diseases, including COVID, and how they can be affected by environmental change. And this is particularly the case for mosquito-borne diseases, and recently seeing outbreaks of Japanese encephalitis, which are also moderated by environmental conditions. Of course, one of the main focus of the network is to look at the environmental stressors and health and develop better evidence about the associations between exposure and health outcomes, but also importantly, to look at interventions and policies which will improve health and well-being. And many of these interventions, you can see here highlighted on this slide, will have multiple co-benefits for health. So active travel will have direct benefits for cardiovascular health, but also improve the quality of the air and the urban environment. Same applies to healthier diets, which have multiple benefits for health, but also will reduce the carbon footprint of the coming from the food sector. Same applies to clean energy, green spaces, better urban environments, and better primary health. So many of these interventions, many of these policies will have multiple benefits, which we can quantify and monetize when we use data from cohort studies, evidence from cohort studies, but also mixed methods, so using qualitative and quantitative data from other types of studies. Here you see the landscape of the HEAL network. It's a very large collaboration, 100 investigators from around 30 institutions from across Australia. It's very interdisciplinary. As I said, some of the research is qualitative, some is quantitative, but very much focused on action and evaluation of interventions. We have a number of structures which form the governance of the network, and you can see here the National Implementation Center, the International Advisory Board, the Indigenous Steering Committee, and the International Reference Group. What's very important to highlight is the distributed nature of the network. So there are regional hubs in all jurisdictions and regional communities of practice which bring together researchers, policymakers, data custodians, and community organizations. I've listed here a number of those organizations, and I think what's important to highlight is the role of data providers in the context of today's webinar, and the linkages that we can help form between data providers and the data available, and also healthcare organizations and people working on environmental exposures. So a lot of the linkages we'll be interested in are between data custodians which collect and manage health data, but also those organizations which manage environmental and climate data, and then the data, socioeconomic data, which are also very important when it comes down to control for confounding in epidemiological studies, and also when we try to monetize the impacts and benefits of different interventions. Well, I will pause here. As I said, there are many opportunities and challenges for environmental health research in relation to the usage of data. I think what's very important in the context of the HEAL network is to promote interdisciplinary research, and we have a number of opportunities. So we'll be advertising for around 30 postdoctoral positions across the different partners of the network, and around 20 PhD students who are going to be funded by the network. And a lot of the focus will be on data linkages, data systems, and decision support systems that can promote environmental health. So I will pause here. Thanks for having me in this panel. I look forward to the discussion.
Thanks. Thanks very much, Sotiris. I'd like to introduce now Associate Professor Jeff Morgan. Jeff is an academic at the School of Public Health and also the University Centre for Rural Health at the University of Sydney, which is located in Lismore in northern New South Wales. He's the Chief Investigator for the Centre for Air Pollution, Energy and Health, which is an NHMRC Centre of Research Excellence. Jeff.
Thanks, Michael. And just to a slight change, that I'm one of several chief investigators for that, CAR, CRE, the air pollution CRE. So thanks for that, Michael. Just to pick up what Sotiris was saying, I'm fortunate enough to be part of the HEAL network and very excited about this fantastic opportunity we have in environmental health, assessing environmental change with research support over the next several years. And we'll be advertising some postdocs soon, so please keep your eye on this space. I've been fortunate enough to have some experience with the 45 and up cohort, looking at environmental hazards for health, including air pollution, neighbourhood walkability, green space, social determinants, and including extreme weather events. And as Michael said, I'm based in Lismore in northern New South Wales, and we're currently experiencing an extreme weather event that just won't go away. It's revisited us again, and there's flood concerns overnight in Lismore. So just to emphasise that environmental health is a truly intersectorial field. People talk about silos in health. That doesn't apply to environmental health. There's epidemiologists, toxicologists, there's clinical medicine, and there's exposure science. And many of the interventions to take action around environmental hazards mean linking with social, ecological, environmental policy and regulation and the related agencies, as well as the health agencies, of course. So we often like to broaden out concerns about social determinants of health to a more eco-social assessment of health. I'm not going to talk much about cohort studies apart from just agreeing with what the previous speakers have said about their importance for assessing the health risks of environmental hazards. But just talk about as an early career researcher, working in environmental health is often not a traditional career trajectory. Fortunately, over the last few years, there's increasing opportunities in traditional career trajectories around environmental health. But historically, a large number of people have got into environmental health from non-traditional ways, from working in health agencies or even working in the private sector, and also not typically from a health background because of the intersectorial nature of environmental health. So I just encourage people to be creative about their career trajectory if you're interested in environmental health. Having said that, environmental health is a relatively small field in Australia, but it's expanding. But it is a large international field with large international research societies you can link into. There's historically been limited opportunity for funding in environmental health research in Australia. And so it's important to collaborate with people who are currently involved in environmental health research or with your group as a whole because of that competitive nature and the limited amount of funding. And also encourage people to look at non-traditional funding sources. For example, perhaps smaller contracts or consultancies with government agencies or other groups, not the traditional ARC and NHMRC funding, but of course, you know, they're great options as well if you're fortunate enough to get one. So given the limited opportunities for environmental health research, but just to emphasise they are expanding, it's important to make sure that people in this area can get access to data, useful data, high quality data. And fortunately, we do have high quality environment and health data for environmental health research. So there's moves around to make health data and environmental data more widely available to people. And so the importance of sharing data, I can't overemphasize that in environmental health research, and sharing expertise, particularly around exposure assessment. exposure assessment is probably one of the most difficult aspects of environmental health research. Assessing exposure to environmental hazards is not like clinical medicine. You don't know whether someone's had a drug or had a treatment. You often have to infer exposure and infer dose from a whole range of environmental measurements. And that's a whole area of science in itself, exposure science. And often people come to environmental health with a need to develop those skills or need to develop that understanding. So think about exposure science and exposure assessment when you come to environmental health. And in environmental health, there's a bit of a tension between doing smaller studies where you have much more detailed information on the health outcome and the exposures compared to larger studies with lots more subjects where you perhaps have not as much detail. And so we might mention some of those issues later today, but I'll just leave it there. Thanks very much.
Thanks very much, Jeff. I'd like to move on to introduce Dr. Lucy Gunn, who's a senior research fellow at RMIT University in Melbourne, and she's interested in studying the relationship between the built environment and health. Her research is interdisciplinary, and her recent projects have spanned economic evaluation of brownfield and greenfield sites, transit-oriented development in metropolitan Melbourne, and creating livable cities using indicators of livability. Lucy.
Thank you very much, Michael, and thanks, Ellie, for having me. And very nice to have the previous speakers help deliver some of the key points as well, because I think I'll be bouncing off them very much. As Michael mentioned, my research is looking at the built environment and health, but I just wanted to expand that a little bit or explain it in the sense that when we're talking about the built environment, my research and that of the centre that I sit in, which is the Centre of Urban Research, but also the Healthy Livable Cities group within that, we very much work in that interdisciplinary space of looking at the urban environment. So looking at the environments where most people tend to live. And the key questions that we're really focused on is understanding which of those environments influence behaviours. And for the longitudinal kinds of data sets that we have access to, and also cross-sectional data sets as well, it's really this understanding of which components of the environment influence our behaviour, but particularly walking and cycling and use of public transport and also, unfortunately, cars. So understanding which levers we can pull to influence those kind of behaviours so that we can then feed back to policymakers and practitioners. We've been relatively successful with a lot of our studies, even though they have been cross-sectional. There's still value in cross-sectional analyses because they do help support some of the kind of causal thinking that comes through in the longitudinal analyses. And we've been able to influence policies and to shift up some of the targets within those policies to increase density, for example. Density is one of those key components that underlies walkability. So the idea there really is to be creating that research evidence that helps decision makers and people in government and policy be able to change their policies so that we can create these better environments. I wanted to just talk a little bit briefly about some of the kinds of data sets that we have access to when we're looking at transport modelling. One of the key ones that we have is the Victorian Integrated Survey of Travel and Activity, which is a VISTA data. But across Australia as a country, there's quite a few different types of travel surveys, and they are also partially longitudinal in the sense that they are repeat cross-sectional. So there's a lot of transport data out there that can be used, and we tend to rely quite a bit on that. Another data set that's also very specifically looking at the environment and also health behaviours is the RESIDE data set that's in Perth. And that was collected over 4 waves, and that was very specifically looking at different types of developments. So of developments that were livable and in particular designed according to the livable neighbourhood guidelines. So the idea there was that you had these new developments being built to be supportive of healthier behaviours, but really the longitudinal analysis itself was designed to pick up whether it was actually effective or not. Unfortunately, it was a little bit inconclusive or not very clear. But there were some good results from that. And another data set of interest is also the habitat data set. And the habitat data set's from Brisbane, and it's focusing on older people, so aged approximately 40 years and above. And that also has 4 waves of data and environmental exposures for the city of Brisbane at the census collection district, so very fine-grained data. So I just wanted to reiterate the point that Jeff was making, that we do actually have some pretty amazing data sets out there that can be used for longitudinal analyses. And we also have data, particularly here for the whole nation, from the Australian Urban Observatory, which is all livability data, that's spatial data. And this goes back to that point about the work that we do being very interdisciplinary, and to be creative with your career path. My career path is not in public health, it's actually in econometrics and statistics. So one of my first jobs when I finished my PhD was actually to be creating data, which was processing survey data, but also creating spatial maps of data through Community Indicators Victoria. And that project morphed across time into looking at livability more explicitly, and that became the Australian Urban Observatory, which is now being led by Associate Professor Melanie Davin. Later on, if we've got a bit of time, we can talk more about the data that's available there, but I'll leave that to Ellie and Amanda and Michael to tell me if there's time for that. So I think really those are probably the key points, just to say that longitudinal data is very much the gold standard. It does require a certain skill set to be able to handle that data set or those data sets. I won't go into that too much because I think Joe's going to talk about that in his talk that's just coming up. So thank you very much.
Thanks, Lucy. And yes, Joe is coming up, the last, Joe van Buskirk, the last of the panel members. Joe is a biostatistician in the School of Public Health at the University of Sydney with an interest in environmental epidemiology. He also works in the Sydney Local Health District Public Health Unit as an epidemiologist, he's translating academic findings into policy relevant public health initiatives locally in the Sydney Local Health District, where we happen to be located. He's graduate of the New South Wales Health Biostatistics Training Program and also the MPH program. Joe.
Thanks, Michael. And thanks, Lucy, for the little lead in there. That was really good. So as opposed to some of the other panel members here, I'm very much on the early end of the mid-career spectrum, early to mid-career spectrum, and very much on the data side of things. So as Michael mentioned, I'm a biostatistician by training. And my experience through the training program that I went through was much more in line with public health data and administrative data and data sets that are produced by public health epidemiologists and biostatisticians and clinicians. But turning to my academic work with Sydney Uni School of Public Health, I've been dealing much more with environmental health, and as Jeff mentioned, exposure assessment has been the big focus of that. And as Ellie mentioned to begin with, and other panelists have mentioned, environmental data is incredibly interdisciplinary. So it works across multiple different fields. And I want to kind of talk about just some of the kind of practical aspects of having to deal with that and having to be on the receiving end of some of those data sets and how they can be quite different and challenging. So these data can be produced by data scientists, climate scientists, meteorologists, physicists, chemists, biologists, as well as produced by large institutions like NASA or CSIRO or the Bureau of Meteorology. And all of these come with individual formats and methods and outputs and precision tolerances that differ across the different fields that produce them. And it's quite important as a biostatistician or anybody using this data to kind of understand a lot of what the methods that have gone into them and the bias and the error that might be present in these models that we use for generating exposure assessment. Not only that, they're very, very large data sets, and there's a tendency to produce very high resolution data sets. So both high spatial resolution, so really fine data resolution, but also temporal resolution, so hourly estimates of exposure assessments as opposed to annual estimates. And it's important to recognize that high resolution doesn't always mean high precision. And for many of these indicators, the bias in the models can be quite opaque because all we see is a very pretty map at the end of it that models an exposure, but we don't really see the errors or the bias that might have been produced in when that data was modeled. So for example, many indicators, major cities tend to have more precise information due to their the higher density of monitoring stations, as well as other covariates that contributed to the modeling of that data. In addition to that, when we look at linking this data to cohort data, we have very real concerns with confidentiality and linking to location-specific exposures. So sometimes it's very tempting when we see a very big data set, very high resolution data set, to get specific location-specific exposure of a participant where they live to, 1 meter tolerance, that kind of thing. But institutions can be very resistant to provide this location-specific data. It can be very difficult to get access to it, and we may have to go through very laborious processes to get access to this. Anybody who's worked in this space is probably familiar with that. And also geocoding participants isn't always that easy. It can be laborious, it can be expensive, and is it even meaningful at the end of the day? It can be tempting when we're confronted with these high resolution exposure data sets to get location specific exposures, but as I said before, they're likely subject to some error and bias in the estimation. As my colleague Ivan always mentions, Ivan Hannigan, we have to be careful of spurious hyperprecision in these models. Hyperprecision, just because we can produce high precision estimates doesn't necessarily mean we should. And also a more obvious point, but if we're producing estimates of an exposure, people tend to move around. People don't stay in one spot in their house. So it can be more pragmatic and even meaningful to use aggregated data from a lot of environmental exposures to suburb specific, or base it on road network buffers, say walkability buffers around people's specific location, or simple Euclidean buffers, so a 2 meter radius around somebody, to kind of capture the real world exposure and hopefully try to smooth out some of the potential errors in the model and try to remove some of the bias as well. That's just kind of a brief overview of some of the things that I've had to face transitioning from a more public health background into environmental health data. And I guess I'd also be remiss if I didn't mention that our small team, so me and Associate Professor Luke Nibbs, we work across the Sydney Local Health District and the Sydney Uni School of Public Health, where we will be hiring for a research officer position. So it's a really good opportunity for anybody who'd like to get into the ground floor in this field and kind of get a bit of experience on the data that's out there and the analyses that we can do, both at a local level at the local health district, but also kind of broader across the field of academia. So thank you.
To turn to Ellie now to lead the discussion session. Could I just remind you all to keep as participants, to keep your cameras and microphones off, but for panel members to have cameras and microphones on.
Thanks, Michael. So for participants, if you could start putting some of your questions in the chat, that would be great. We've also got a couple of questions that we prepared earlier for the panel. And I do just want to note that we've also got online Karen Bleicher and Matt Gorringe, who work with 45 and Up and Shaw at the Sax Institute, as well as Catherine Tragenta from the Australian Longitudinal Study on Women's Health. So if there are any specific questions about those cohort data sets or platforms, I'll also flip to them as well. So I guess the first question I had for the panel was this sort of question that Richard started off with and that others have referred to around, when is cohort data in environmental health sufficient as evidence to inform, say, a new program or service or decision that a policymaker or a minister might make based on that evidence. And I'm also sort of thinking about in tobacco control, if we had only sort of asked for or done work in terms of the kind of traditional gold standard of a randomised controlled trial, we wouldn't have seen any of the success that we've had in terms of tobacco control policy and legislation and regulation in Australia. So I'm sort of thinking about that, and I'm wondering if our panel members have got some examples of when has cohort data actually been sufficient to inform policy making in environmental health. Maybe Richard, I'll start with you, if you've got maybe an example of where you've had that sort of win, which is you've presented that level of evidence and decision makers have said, great, yes, we'll act based on that evidence.
That is a very good question, Ellie, and I do wonder, like, coming from a small jurisdiction like New South Wales, maybe not. I think perhaps we often follow other people in terms of how we respond. I do think, like, I mean, I guess the example, the most recent contemporary example that I have in my mind would be, say, the PM2.5 regulations. So PM2.5 are fine particles, and they're in air, and they're the ones that are likely to be the most significant from a health point of view. And New South Wales, well, Australia actually has the lowest, I believe, at least the lowest particle standards of anywhere in the world. And you know, there's obviously, in coming up with these standards, it's a trade-off between what you think the health effects might be versus the cost of achieving them with and the impact it might have on, you know, polluting activities. But I do think the fact that we can always fall back on the idea that there is now a plethora, and it's not just one, but a plethora of evidence from cohort studies in all kinds of different environments, not even in Australia, but yeah, essentially that we've got all this evidence that means that we're all fairly confident that there is a causal association, is pretty powerful in that sense. It enables the government to implement the most stringent standards, which, you know, in Australia is not so challenging because air quality is pretty good. There aren't that many pollution sources compared to other parts of the world, but it's still an important step that ministers have taken, and I don't think they would have taken it if there hadn't been, you know, this sort of overwhelming level of evidence underlying it. So, I mean, what I would say, though, is, on the other hand, is we've often done a whole bunch of things with much less good evidence. And, you know, and so a lot of drinking water, a lot of standards generally are more based on toxicology, and, you know, there's policy approaches to how you deal with toxicological evidence in these sorts of assessments. But we are able to do it with less. But you get into the complexities, I suppose, of environmental health policy and what strategies you have to manage risks, such as precautionary approaches and when that's appropriate and those sorts of things. But what I would say, yeah, so air pollution is for me the best example of where cohort evidence has really driven pretty substantial action over many years.
I'd like to add to that, because I know a lot of your work has really focused on air pollution and using cohort data to build that body of evidence. Is there something that you'd like to add to that?
Yeah, just the importance of the literature in relation to a question you're looking at. And while it's great to have your own study and local data and local results, I think it's really important to see that in the context of the international literature, and that particularly in environmental health, where risks can be quite low, but the burden of disease associated with that risk can be big because millions of people can be exposed. So it can be important to sometimes combine cohort studies from a whole range of locations with meta-analyses and other processes. So to see your work as part of a broader whole of the literature and cohort studies and other types of studies, that I know when I do a study, I think, okay, this is the answer, this is it, everyone can go away, I've worked it out. But after you sort of climb down through your enthusiasm about having finished a study, reality takes hold and you realise that there's a whole lot of unanswered questions, a whole lot of uncertainties. and it's good to see the context of your work.
Thanks, Jeff. Anyone else from the panel want to comment on this sort of question of what is good enough evidence in this space in terms of cohort data and other forms of data and evidence?
I might say a few things, Ellie, because this question is a philosophical debate. It's a torture for me, to be honest, to think about it in my day-to-day life of, you know, the type of evidence we produce and the type of evidence that inform decision making. Because as I alluded to during my talk, I feel that there is this tension. It's much easier to have a quick and dirty, you know, descriptive data on a map and correlational data for policymakers to absorb. But on the other hand, whether these association that we see is causal is something else. And I personally go through this struggle. Am I doing harm or doing any contribution to the field if I want to, you know, introduce more, I guess, causal influence methods to really try to get down to the bottom of the causation? Would that be actually a detrimental effect on the field and our society if my study actually finds that green space doesn't necessarily add years to your life, for example? So this is a philosophical debate to myself. But I do think it's important that we look for other creative source of data as well. Natural experiment, for example, when changes happen in environment, if we could somehow get the information ahead of the changes, if we could, you know, be pragmatic and with the funding and resources we have to use that sort of data to supplement cohort data, modeling data as well, and also I guess detach our ego from our findings, like what Jeff was saying, not believing that our study is going to change the world, be humble enough to see through other perspective, look at the broader range of literature, and really kind of ask yourself hard questions. Am I, you know, could there be other explanations for this finding, or am I just so blindsided by my own findings that I think that this is going to change the world?
Richard, did you want to add something further?
Sotiris can go first.
Oh, thank you. Just to say that I mean, what can change policies is a very complex kind of issue, and sometimes the best science doesn't instigate policy change, but we have some evidence from a single case study that creates a lot of momentum for change, and we've seen that in the air pollution space. For example, there was the case of this young person who died from asthma in London a few years back, and the case was taken to court, etc. And eventually that was air pollution was written on the death certificate as a cause of death in that case, and that has brought a lot of media attention, a lot of public attention, policy attention to the issue of air pollution. I mean, it's not the only thing, but sometimes very powerful studies. Richard mentioned cohort studies are often considered to be the golden standard. They don't necessarily instigate immediate change, but evidence from other studies or anecdotal evidence sometimes can generate this political momentum that brings about change. And I think in terms of cohort data, we have the cohort study. We had the major studies on air pollution in the 90s, mainly in the US, the Harvard six city study, the American Cancer Society study, and that was a turning point, and that provided the evidence for a lot of the guidelines and regulations on air quality that we've seen in the last 30 years or so. But there is a realization that we need cohort studies from other parts of the world as well. You know, there is an issue with cohort studies always, or in most cases, being carried out in high-income countries, and you know, there are questions about the transferability of findings to other settings, both geographical and socioeconomic settings. And of course, more recently we've seen cohort studies, environmental health studies in other areas which relate to environmental change and climate change, for example, in relation to flooding and psychological impacts. So there has been an ongoing study in England after the severe floodings of 2013, highlighting the long-term psychological impacts of flooding, and that resonates now with what communities have experienced in North New South Wales and Queensland in recent weeks. But also we've seen cohort studies emerging about temperature effects, the effect of temperature variability on cardiovascular morbidity and mortality. And so many of these studies come from China, and they're often very large studies. So there is emerging evidence, a lot of good work in this space. But of course, it's not the only thing that we should be looking at when we review the evidence of effects and effectiveness of interventions.
Richard, did you want to add something further?
Well, just a small thing actually, and it sort of follows on from this idea of local studies and the like, because I think often, so sitting where I'm sitting, where you get kind of particular issues that arise, often there's a call for doing local cohort studies, and I suppose the caution really is that we always provide is you want to think twice, I suppose, before doing a study. And I think this has broader implications, but you probably don't necessarily want to go down the path of doing underpowered studies, because especially if you want to affect change, you do need to do the job properly with the cohort studies. And as Sotiris said, often actually the studies are probably perhaps less important than the anecdote in terms of affecting change. But yeah.
Lucy.
I just wanted to add some comments about sort of in response to what Melody was saying as well, that she feels very self-conscious about the publications. I think that what policymakers are interested in is the weight of the evidence, which comes back to both local and international evidence as well. But I think in our experiences, it's not necessarily longitudinal evidence that might get across the line. It's what the policymakers and these practitioners can absorb as well. So there's some element of capacity building that's required in the people that we as researchers communicate to in order to we can say that we've got this wonderful evidence, it's longitudinal, but if they don't understand what that means, then it's kind of falling on deaf ears. So I still think that the skill level and the understanding of what it means to have longitudinal evidence potentially needs to be built in the people that need to understand that evidence. So building capacity in our in the governments or policymakers that learn about what we do. But I also think there's some aspect of timing. I think that when there's some kind of policy or agenda that's on the table, they're actually looking for evidence. So that's the point where if researchers can understand that, then we can engage with them in a meaningful way. We've been very lucky, I think, here in Melbourne that a few years ago, there was the 15-20-minute neighbourhood initiative came on the table through the Department of Environment, Land, Water and Planning, and our colleague and the director of our centre, Billy Giles Cortai, was part of many of those discussions. A lot of our research evidence she was able to communicate that research evidence to them, and then it's gone into the policy. So it's been referenced in those policies. Same thing with the VPA guidelines. So the Victorian Planning Authority guidelines help to build up new developments. Some of our research has gone into that to increase the density targets, but just happened to be the right timing, as well as having the right kind of research that they could understand and absorb, having the right person explaining it to them. So I think there's some aspect of capacity building in the people that we work with, and I think the onus, unfortunately, is on researchers to be that conduit, to be the oil on the engine to make it run, to help communicate these findings. Even if your publication's inconclusive, maybe there's other publications out there that help to prove the point. So it's not just one thing, it's many things.
Thanks, Lucy. And I think sort of what you've all referred to is this kind of evidence ecosystem that we keep adding to through research. And I can just see that there's a comment or a question here from Kate in the chat about bringing different types of data together. So, for example, cohort data and RCT data collecting prospective cohort data. I know, Lucy, some of your work and others, you would be combining both cohort data and administrative data through data linkage, or in some cases, people like Melody might be looking at wearable technology that produces huge amounts of data. So I'm wondering what the thoughts are of the panel in terms of that. Maybe Melody or Joe or Lucy, you might want to comment on that. How do you bring it all together to help generate that evidence ecosystem?
A lot of grunt work, if I could jump in first. I think it takes an incredible amount of energy and effort and teamwork to build it together. It is interdisciplinary. I work with geospatial analysts who are experts at looking at administrative data and understanding spatial relationships. I also work with biostatisticians and modelers. I'm a modeler myself. I'm also working with people who are non-technical, so I have to be able to bridge that gap in explaining hard technical things to non-technical people. And then Joe was alluding to in his talk just how detailed the data is and how you have to work even within your own university and with data providers to get hold of that data. It is like gold. The geocoded data that we have, it is people's homes, and then you have survey data that comes from the administrative source, which might be their age, their gender, if they're married, if they have children. It's incredibly detailed data. It's personal data, and they don't want you to touch it unless you have the right systems in place. And it literally takes months to get those kind of things lined up so that you can even look at the data, let alone analyse it. On top of that, there's sort of challenges in modelling the data, and Joe didn't go into all of those challenges, but if you're talking about spatial data linking in with behavioural data, you have to accommodate that in the modelling that you do. So you have to factor in clustering, because what I do will be similar to what my partner does because they live with me and we're likely to be similar. And same thing with the people in my neighbourhood because we have the same neighbourhood. So you have to accommodate that in the modelling. So I think someone in the chat was sort of saying, well, what kind of techniques do you use? Well, clustering or multi-level analyses are some of those techniques. Generalized linear models, those are other techniques. You might look at fixed effects regressions or random effects regressions. Depends a lot on the research question and what really matters.
Can I add to what Lucy said?
Sure. I'd just like to echo what Lucy was saying in terms of the different methods that are used in the analysis. So many different types, and it depends on the exposure that we're particularly assessing. There are new kind of models that are being developed to assess lagged effects of exposure models, exposure effects such as pollutant exposure, heat exposure, that kind of things. So it's a really exciting field in terms of the different methods that are being developed. And of course, as Lucy said, it's very important to take into account the kind of the geospatial correlation between these exposures as well, and any sort of patterning that emerges when we cluster together those geospatial units in the data.
Ellie, could I just add something to that?
Absolutely.
So I think what I've seen sometimes is often when people come into environmental health, like everyone, like me, you bring your own set of tools with you. And so sometimes people will implement what they think is the best tool for this analysis. But once again, it can be really important to go back to the literature and just see how other people have done this in the context of environmental health. And one of the things about going and talking to statisticians about environmental health studies is sometimes statisticians can sort of want to reinvent a new methodology when there's sometimes a well-worn methodology for doing this stuff that's been published in the literature a lot and has been demonstrated to work. Sure, there's plenty of scope to do new methodological assessments of work. That I'm not saying that that's not the case, to develop new methods. But if you're getting into this, looking at the methodologies that have previously applied can be very beneficial.
Melody?
I just want to add on to what Jeff said, because that's something actually I wanted to share as like a not so good personal lessons. And it's a personal lesson that I learned, especially with early mid-career researchers in the audience. It is very tempting that you kind of want to be this do-it-all person, that you learn to do, geospatial data handling, statistical analysis, and then you read a couple of papers and try to mimic what the authors have done, or go into YouTube and just find how to do certain analysis. I've been through that because, in our career, I guess, progression, there is certain time that is good for such exploration. But this is a really vast and very deep field. There's a lot of things that you actually don't know that you don't know. So just by reading the papers and replicating exactly what this study has done, you don't know what's the nuances in their data, and you don't know what's the difference between theirs and yours. So I just want to highlight again the importance of collaboration, reaching out to experts in the field. They would know this so much better than you do. And so I think that's a personal lesson that I have learned it the hard way, and I want to share with others. And the other thing I want to kind of highlight as a challenge, and maybe just the poke a little bit for us to think about. I always talk about this in terms of the challenges in any sort of environmental research, whether you're doing observational studies or quasi-experimental studies. Oftentimes these challenges arrive, whether you are linking data, whether you're collecting data, that throw off your timeline. I'm personally dealing with that as well. Our funding organizations tend to think that this is all linear. From year 1 to year 2, you're doing this, year 2 to year 3, you're doing that. And as researchers, we spend a lot of our time going through really stressful period trying to back them to extend the funding, because things don't always go in a linear fashion. So I'm, again, going through that myself. And I just wonder if we could, get our voice heard and start to have this conversation about how we actually have a funding structure that facilitates good quality research in this field.
Well, and I was actually going to ask a question to the panel about how do EMCRs get funding to do this kind of research? If panel members would like to share some of their own experiences of that, there's obviously NHMRC funding, MRFF, ARC funding as well. But as we've seen in the budget last night, that can be somewhat limited, and it can be really hard for EMCRs to get that funding. Are there other funding opportunities out there? I'm wondering who'd like to share first, both the highs and lows of securing funding to do environmental health research.
Can I say a few words?
Yeah.
I think that's a very good point, and we know very well that the field, environmental health field, has been through many years of underfunding. There hasn't been much funding in this space for a long time in Australia. I think we are reaching a turning point to some extent with the investment to the Hill Network and a number of other initiatives, and which will obviously provide opportunities for researchers across the different career stages. So in Hill, we do have some seed funding opportunities. I know that the CAR CRE has also seed funding opportunities. So there are opportunities for early and middle career researchers, but of course, I think what I would give as a piece of advice is to try to work collaboratively and with networks, with the other established researchers and interdisciplinary. So I think the trick is to work collaboratively and obviously get involved in larger studies, but also apply for smaller opportunities which might be available specifically to early and middle career researchers. And then there are a number of opportunities also available internationally, so it's and this could provide also some funding for specific studies, but also to opportunities to liaise with other international groups.
Thanks, Satris. Jeff, did you want to say something?
Yeah, look, an example of sort of plugging away for a while around the edges and then getting some funding is a study we're currently doing on the long-term effects of air pollution on health, called the APMA study. Now that's an NHMRC funded project that was funded relatively well for 3 years to look at the long-term exposures, air pollution. That application was put in several times before it was successful. And prior to it being successful, we actually did a study of the long-term exposure of air pollution on health using the 45 and up cohort, but it was done on a shoestring. So we couldn't do a lot of the detail we hoped to do, but we did a legitimate analysis that produced a result that was equivocal because of the limitations. But that didn't destroy our chance of getting funded. It in some ways potentially helped because it highlighted what needed to be done if you were going to do this well. By well, I mean with the resources to do the sorts of detail that needed to be done. And so we've now had this funding for 3 years, and we've done the whole project quite a different way, where we've focused much more on the exposure assessment and spent about 2.5 years working on exposure assessment for this study before we even do the health analysis, because the funding provided us with that luxury. So sometimes it's doing an imperfect study, but uses the data well and produces robust results, but acknowledges the limitations, and that can inform the more detailed funding proposal that you do.
Yeah. I was also just thinking in terms of funding. I mean, we've obviously been talking about the sort of major funding bodies for health and medical research and other types of research, but I was wondering if maybe Lucy or Richard or Joe wanted to talk about, I guess, other sources of funding, whether that comes from, say, partnerships with government departments who might be interested in a particular research question, or perhaps even industry and other groups like that. Lucy, did you have any reflections on that?
A little bit, yeah. So we haven't necessarily been perfectly successful in getting funding from other industry-based partners, but we have been successful in creating a partnership, and that's sort of the foundation for getting funding at a later stage. But where we did get funding from, and this is maybe of interest to early career mid researchers as well, or early to mid career researchers, is that sometimes universities internally have small funding schemes, and that might be enough to help leverage some of your work into creating a small project that you get 1 or 2 publications out that become the proof of concept that you then leverage into a bigger grant. So we've sort of been trying to do that with one of our projects where we've been working with the Department of Transport. We've been able to get proof of concept of looking at transport demand modelling, linking in with health impact assessment modelling. So it's not necessarily, it's not a longitudinal study, but it does point to this fact that you can do small publications that then become sort of the foundation for something bigger and larger, and it helps you line up relationships with people in industry, which then can help you with letters of support. So we've been able to do that in our circumstance. We've been able to work with Department of Transport, who then kindly gave us a letter of support, which then we were able to use for an NHMRC grant, which we were successful in getting to continue that work. So it is about chipping away at things and seeing what you can get wherever you can get it. And it might be that you're not chasing the big fish, you're actually chasing some smaller fish, and those smaller fish help you with providing that proof of concept, the smaller study, but the smaller study, once published, helps leverage you into a bigger study with more funding. So that's worked for us.
Richard, are there other ways of funding research, like through government or through particular schemes?
I was going to say you should ask Jeff and perhaps Sotiris about that. So they from the other side. But certainly, I mean, from time to time, and I'm not, I have to say I'm a little bit out of the loop at the moment, but from time to time, obviously opportunities with government funding do come up. And for example, there was a climate change node in New South Wales that funded research in various ways. We occasionally, and I would say that as individual departments, we often aren't that flush for cash, but from time to time, if an important issue comes up, then we are able to, put money into it for research. So I think it's just having links to people like me or in the environment department, things like that is helpful, because then I guess you just be more aware of what those opportunities are. New South Wales Health, and again, sorry, I'm a little bit out of touch now, but we have historically had things like translational research grant schemes, which probably with a bit of ingenuity could be be used in the environmental health sphere. So I think it's I mean, there are opportunities. They can be a little bit ad hoc, and trying to build those relationships with people in the government sector is probably a good way of keeping on top of them.
I was going to just jump back in there, because I really absolutely agree with what Richard's saying. So the process of working with all the different people in industry and government that I've been through and I helped to set up also threw up opportunities that I would have never have chased. So making very personal contacts with individual people. They actually said to us, look, we do have some small amount of funding here and there. Maybe it's not very much, $5,000 to $10,000, but that's enough to tie you over to do a small publication of some sort, and possibly just a case study or an intervention, like something that you've got existing model that works, and you apply it to that case study, and then you're off and running with something. So I don't think I would have ever found those sort of opportunities had I not established those relationships in the first place, by doing some research in other projects as well. So it is a process of engaging with people out there who might have funding, and it's also about asking the question and casting your net far and wide, because you never know who's got a bit of extra money sitting there that they have to spend before the budget runs out. So it's a huge opportunity. And just one other comment, also, because I'm also part of the HEAL network, there are some postdoc positions there too. So again, it's an opportunity for you to be working in a space that perhaps aligns with what your interest is anyway. And if that's a good launching pad for you, then you should be chasing those too.
Yep, and if I could just jump in as well quickly, just to echo what Lucy was saying. My role is fairly unique in that it's a specific partnership between the local health district and the Sydney Uni School of Public Health, but still kind of working out the opportunities within that space. But a lot of our kind of the establishment of our role in the last 6 months that I've been working in it is to just demonstrate the utility of some of the techniques that we've been using, and how they offer both local and kind of national or even international kind of, they have international applications. So demonstrating just like the use of geospatial analysis to a local health district across the different environmental health priorities has really piqued the interest of people around the health district. And I don't know where exactly that's going to lead at this stage, probably just more projects within the local health district, but that's an ongoing kind of development of those partnerships to see just the range of use of some of this data and the techniques that we're developing.
To hear about that sort of level of investment that the local health district is putting into that area. Sotiris, did you want to add anything about HEAL or other opportunities for funding and collaboration and partnerships?
Thanks, Ellie. So I fully agree with the colleagues, Lucy, Joel, Richard. I think it's important to diversify when we look for funding and look at different types of funding. NHMRC, ARC can be very difficult, very competitive. I think a key message is, not to get demoralized. We've all been there, and we've tried many times, and we had many unsuccessful applications. I think it's important to keep trying, and also thinking about alternative ways of putting in applications. Just to give an example, I mean, obviously, HEAL has now a number of opportunities open for funding. Postdoctoral position, PhDs, there will be seed funding opportunities in this space. So, this obviously will catalyze research in environmental health, and it's an open community. It's you don't have to be a member of the network to apply or get some seed funding. But also, I would like to draw attention to other opportunities for example, from charitable organizations, government departments were mentioned earlier. Coincidentally, I sit on the scientific advisory board of Asthma Australia, and there are funding opportunities every year, and quite often we struggle to get enough applications. So maybe some of the focus of the scope of some of these opportunities is relatively narrow, but quite often we don't have enough applications, if anything. So there are opportunities out there, and I think obviously we all have our area of expertise and favorite research topics, but it's important also to be flexible and try also to address questions which might not be exactly what we did in our PhD or or our postdoc. Think creatively and try to address up and coming areas of research or topics which are slightly outside our core research interests.
Thanks, Sotiris. Jeff, did you want to add anything to the funding question before we move on to the next question?
Just to agree with Satris that it's important to diversify. The Australian Research Council, the ARC, is sort of non-traditional health opportunity. The MRFF, there hasn't been a lot of success with environmental health, but there's been some success with MRFF and environmental health work. So, and just the importance of collaborating, that if you look around and you see someone with data or you've got an idea, it can be helpful just to go to them and talk to them about the opportunities for you to work with them on your idea. And that could save a lot of pain for you in the short term. Obviously, it's a short-term fix, and you have to. People may be doing that work already, but to engage in those conversations, I think, is useful. Thanks.
Could I just add?
Yeah.
Sorry, Ellie, my experience with funding is very different and my perspective could be very different as well. But Jeff just again reminded me of, I guess, my own personal approaches. I didn't do huge grant applications for the first few years since my PhD because I think I was not confident enough and I was focusing on track record building. So I think to me, perhaps a slightly alternative and practical approach for EMCRs, particularly early EMCR, is not to chase funding for sake of chasing funding, but in the meantime also allocate your time to actually developing research output. So that has been my approach. I focus more on the research output during the first few years since my PhD, and then now I have a stronger track record to apply for investigator grant, for example, that is more heavily weight on my track record than going, really just go ahead and try to get the idea funded. And how did I get there? Is exactly through what Jeff said. I contact people. Because I see the end game as having research carried out rather than getting the money. So if I can do this piece of research without funding, then I would take it. And then eventually these investment will lead to funding in the long term.
I think you raised a really important point before, which was about the fact that you don't personally need to be an expert in any and all fields. In fact, it's better off to just identify where it is that you've got some strengths or expertise, and then identify, the kind of environmental health research that you want to do needs, say, a fantastic biostatistician or some great environmental epidemiologists or toxicologists to actually seek out and build relationships with them rather than teaching yourself the 101 of toxicology if you're a behavioural epidemiologist, for example. So I think that that's also a really good point for EMCRs to remember. I did have a next question that was about actually accessing data. So how do you think we could make data, cohort data and lots of other types of data more useful and accessible in terms of time, money and funding, sharing, ethics and confidentiality? What's the sort of data infrastructure that we need to do this kind of research? And have you got any big asks in that space that you'd love to see to make data a bit more accessible and useful, particularly for EMCRs? Maybe Joe. At the moment.
Oh, I have a lot of thoughts on this. Well, I mean, I guess just to kind of go over some of the complications that Jeff and Melody and I have had in accessing, say, the 45 and up data, which has been very, very useful in terms of the output we can get out of it. But we work across a big team, and there are certain limitations to some of the access on there, especially not only cost related, but confidentiality related. So when you're accessing the geoprocessing space, which is to calculate exposure assessments, where you have access to a location specific data, there's only really one license that's available to that. And that can be quite limiting in the fact that only if that one person is tied up in a million other projects and can't get to your specific request. I don't really know how we can streamline those that a bit better, but there have been a lot of kind of roadblocks along the way, not least of all the kind of, I guess, bureaucratic requirements for getting access in the first place, and the challenges of contracts that may only be 12 months, and then an access procedure that might take upwards of 6 months, limiting the time that the person hired for the contract can actually work on the project. I don't know. I don't really know what the solutions are. I can kind of give you some issues we've had, but that's about all I really, I don't really know of the solutions at the moment, but I see that there's a need for kind of restructuring to make it a bit easier in a lot of spaces. Melody, do you have anything to add to that?
Yeah, I'm just really pleased. I think Karen is on this call as well. She's been so committed to hearing about all our challenges and trying to make things better. So I really appreciate Karen has heard us talking all about this. So I think the flexibility of timeline is something I raised to Karen quite a few times. And I mentioned that within the funding context as well. So imagining you're aligning the funding timeline with the data access timeline, with your staff timeline that you have to hire at certain time, the money runs out by a certain time. It's extremely challenging. And oftentimes the license started before the person can actually have data access, and then ends before the project finished. So I think that kind of flexibility in that range will be really helpful. And the other thing that I want to add to the wish list will be streamlining the approval process, because every time when we have to deal with another update of linkage data, for example, adding another person to the workspace, it does go through a really kind of laborious process of getting various signatures from various stakeholders, and oftentimes you send things off and it's kind of to a black box, and then you have to chase and remember who has been sent what, and it's very mentally taxing this process, not to mention time consuming. So that is definitely something that we're working on improving for the future users.
Karen, now to talk a bit about some work that's going on in terms of improving access to 45 and up, and also ensuring that researchers are aware that platforms like SURE exist, where you can do all these amazing sort of linkages with different types of data. Karen, would you like to add to that?
Certainly, and I just send a response. I just have to say, Melody and Joe are incredibly grateful for your input, because the only way to make these things better is to hear back that something is an issue. And certainly increasing flexibility and sort of duration of access to data is really important. There are a number of other players, of course, ethics in particular, and all the linkages to different New South Wales administrative data. And in fact, we're working on, even though that's not our responsibility, we are trying to find ways to minimise the time. For example, we've got this big chronic conditions umbrella program linkage we're looking at, which when it gets through ethics eventually, which I hope won't be too long away, will actually just save so much time. Like, I think it'll cut 9 months of time off researchers, and that's a big deal for any researcher, not just early career researchers. But I think from the 45 and up study and SURE point of view, and Matt is the lead of SURE, the SURE stands for Secure Unified Research Environment, and it can be accessed remotely, of course, and it provides a really secure environment to do this really sensitive work using both health data and finely geocoded data. I think Jeff mentioned the challenges and also perhaps the biases with having really finely geocoded data, but there are also great advantages because you don't get those sort of ecological fallacies where you might attribute something, if you know someone lives on a main road versus 5 roads back, there's quite a difference in exposures there. So having the 45 and up study with that finely geocoded data based on someone's residential address and then being able to link it to the administrative data, you can follow daily, if that's how often someone goes to a healthcare provider, all their interactions with the health system. So I guess it's bringing things together that are relevant, to the researcher and maybe not too fine if that's going to create bias, but having the fine data as something you can get if you need it, if that's important for your research, I think is incredibly valuable. So we support, as I mentioned, we're looking at ways to support early career researchers with both flexibility, sharing workspaces, being able to cut on and off with your access to the data so that that's less costly, and just basically make it more affordable. Plus supporting, which we are doing with quite a number of researchers, their grant applications. So, letters of support plus just collaboration with them on that. So anyway, that's how I think 45 and up and short.
Thanks, Karen. And someone's just asked in the chat about the procedure of getting access to some of that data. I mean, in terms of, for example, the geospatial data available that can be linked with 45 and up.
There's an application online, but I'm happy to send it to you as well. And all the data books are online as well.
And Ellie, if I could just jump in.
Yeah.
I mean, I've been observing these discussions for a long time, and it's tantalizingly close all the time. And what's happened in the environment space is that increasingly groups are coming together to consolidate environmental data and make it more broad and clean it, document it and make it more broadly available. And that's really helping environmental health research in Australia. These sorts of data exchange platforms have existed in many countries in North America and Europe for a while, right? And we're just starting to get them together in relation to health and environmental health. But they're a huge benefit. And we're involved in a project with AIHW, the Australian Institute of Health and Welfare, about what level of mortality data they are happy to make available. So making available, say, the routinely collected administrative data, but at more detailed spatial or temporal units or more detailed aggregations of age or other potentially identifying factors that retain the de-identification of the data set and make it impossible to re-identify people in the data set. All of those data confidentiality security issues that ethics and data custodians are concerned about. They're all manageable. And they've been manageable for a while. I know they're difficult, I know they're complicated, but they're manageable. And so that is one thing that could really help environmental health research, to make those broad scale data sets available. Because as Joe was alluding to, what can be unusual about environmental health is sometimes highly spatially resolved data is not always better. Sometimes it can be better, but it's not an always thing. And so making those data sets available in ways that retain data confidentiality and security is important, but also to have ethics approvals that can accommodate a broad range of health questions. In environmental health, there's a lot of environmental exposure. And what you're essentially doing is having a health data set and attaching different environmental exposures. And so they generally don't add additional concerns about data confidentiality and security. And so there's ways of managing that within ethics approvals that can help access for early mid-career researchers, for researchers in general. Thanks.
Thanks, Jeff. And I'm also just thinking, it's not just about accessing data and then being able to analyse it, but how you visualise and share it and help translate the evidence. And I'm wondering, Lucy, if I think we've got time for a quick little plug of the Australian Urban Observatory.
Oh, sounds good to me. If you're okay for me to share my screen, I will do that.
Yeah.
Hang on a minute.
Maybe a bit more about all of the work that's actually gone into building that as an online tool that is available for people to access.
That's right. So is that showing now? It's just a big Australian Urban Observatory slide?
Yep, it's showing.
Yep. Okay, brilliant. So it is a quick plug for the Australian Urban Observatory, but it's a huge digital platform, essentially. Hang on a minute, on the wrong screen. There we go. Oh, it's got some dot points. Here we go. All right, so just a very quick explanation of what it is, but it's a digital platform, essentially a website, and it has some complex urban data and also livability indicators that have been developed over almost 10 years of work, really, partially from RMIT University over the last 5 years, some of that work funded by TAPS, or the Australian Prevention Centre, but also funded prior to that through University of Melbourne, which is where our team used to be housed. But the website itself includes Australia's largest 21 cities. It includes 42 different indicators of urban data, and it's across 9 domains of livability, which includes a livability indicator itself, a walkability indicator, social infrastructure, which is things like access to primary, secondary schooling, access to GPs, healthcare. So that social infrastructure indicator includes a range of different types of key destinations that people require for daily living, really. Access to transport, food, alcohol, public open space, employment and housing. And really the purpose of that website is to help with the translation of research knowledge into practice, but also to create real world impact. So I can't remember who said it, but someone did mention that looking at maps in New South Wales was very helpful in understanding accessibility to some things, but this is really what this website does. So this is the kind of data that's in there. We have a range of different livability maps, and I hope you can see my arrow. This map here is of Melbourne. It shows higher livability in the central areas of Melbourne where it's more established. There's higher density, more access to different types of destinations, but that declines as you move further and further out. And I can tell you for now, for those of you in Sydney and New South Wales, that the map for Sydney is quite similar. The more established areas tend to have higher livability. But without going into too much detail, what they have done as of last week, they've released some new data. So this is actually technically it's longitudinal data. So we have data from 2018 on the left, which is looking at average distance to the closest activity centre. An activity centre typically has a supermarket in it, and that allows people access to fresh food and to basic amenity. But on the right, we have average distance to the closest activity centre for 2021. Now, I just want you to kind of cast your eye onto this orange square here, and it's actually the same map on the right-hand side, but it's a blue square. And if you just look to the left of it, you can see this pocket of light green and pink. And what it's telling you is that for people living in this area, they've actually got worse access to an activity centre in comparison to what they had in 2018 over here, where it's darker green. That tells you they had better access to having an activity centre or a supermarket. So this is allowing you a comparison across time of what's happening in the environment, but at a spatial level. I also just very quickly want to draw your attention to the fact that there are different geographies here. So you can have it at local government area, suburb area. In this case, it's neighbourhood, which is SA1. So it's very fine-grained data. And this goes to Joe's point that maybe you don't need the super fine-grained data. Maybe you need something that's a little bit higher level. So that's just a quick taste of what these maps can look like. This is another example. This is the Walkability for Transport Index. This index includes it's a combined measure. It includes density, it includes street connectivity and access to some destinations. And as I alluded to before, the more established areas of Sydney tend to be better. So you have green, but it gets worse as you go to the periphery of the city. And in this case, we're looking at Lenay, which is in the LGA Penrith, and we have this orange little dot here. It's a little hard to see, but the area around it has changed. So if you look to the right with the new data in 2021, that accessibility or the walkability has actually changed in the area around it. You can see that what was once green is now a little bit purple. That tells you that the walkability in that area has declined. Now, indicators in general just give you that high level perspective of what's going on. The next set of questions will be what has changed. So you might dig into the walkability index and look at the density or the street connectivity, or in this case, possibly destinations. It may be that shops and services have closed in this area, possibly due to external factors, not really sure. But it's really helping to understand that spatial relationship. Okay, so these are the people that you can contact if you want more information about that data. But I also just wanted to say that if you're interested in that data set, it's well worth you looking at it. It's free to register to have a look at it. And there's all of that data is in there that you can see. And some of that data you can actually download, so you can take it away and have a look at it and play with it and see if you can join it to your own data sets if that's what's relevant. So at this stage, I'll just stop sharing my screen. And if anyone's got any specific questions about that data, yeah, please let me know.
I think there is just a quick question here from Chris Standen about obtaining AUO indicator data in tabular format, or is it just through the online maps?
I think you can, some of it I believe you can get in tabular format, and that's particularly the case. I think it's the livability indicator and also the social infrastructure indicators. I think those can be downloaded directly, and I think you can get it in tabular format because it is area based. So, but I would recommend you just have a look at the AUO website and really have a play with it and see what you can get. The other thing you can do if you are after very specific data sets is actually to contact the Melanie Dav and actually Catherine Murray in particular if you are after a much larger data set. So that's a conversation that can be had to get hold of the data.
Thanks. And Lucy, just one final question for you. There was a question in the chat before about the design data for Perth that you mentioned earlier.
This was the reside data set, yes.
Okay, so maybe if you could pop the link in the chat.
Yeah, I'll do it right now. I'll see what I can find.
I think we're probably going to be wrapping up soon, so maybe I might just ask each of the panelists if you've got any final reflections about working in this space and any final tips for NCRs on the call today. So I might just go around the screen. Maybe I'll start with Joe.
Sorry, I don't really know what to say to finish off here. I just want to say thank you to everybody who contributed and the panelists involved, and Ellie and everybody for organising. Yeah, I'm sorry.
No worries. Maybe Mel, did you have anything final to add?
Collaborate, and things are not always easy, but it will be rewarding.
Lucy?
I also think that collaboration is very important, and I think I didn't say this at the time, but it was part of the discussion that it depends a little bit about where you are in that timeline. If you're a very early career researcher or you're more of a mid-career researcher, if you're very early and you want more funding to do more research in this space, it is good to collaborate with others because they will help you write the grants. They will be the leads on the grants, but you'll be doing the work, which is the best place to be because you get to do the stuff that you love, and that helps build track record. So there are different processes for getting the funding, but working with each other and understanding that there's a certain place that you need to be in order to progress is okay. It's a good place to be.
Jeff, some final thoughts?
Look, environmental health is a fantastic area to get involved in. And, you know, it's interesting to be in a country where the national anthem talks about, you know, environmental change. And, you know, we're currently experiencing substantial environmental change, and we have over the last 150 years in Australia, and it seems to be increasing. So there's a lot of work to do, and environmental health is actually a growing field at the moment. So, and I think there's growing interest and there's growing need for researchers to get involved. So, so I look forward to seeing you at meetings in the future.
Sotiris?
Thank you. Thanks for the great discussion today. And I fully agree. As Jeff was saying, environmental health is a growing area of research. Climate change is the global health priority, as said many times by the World Health Organization, by many scholars. There are many other environmental health issues which have been around for a long time, and environmental change has been an issue and challenge in this country for thousands of years. So it's here to stay, and we need to build more capacity and capability in this space. There will be opportunities. I think collaboration is the key, as all colleagues have said today, and working across disciplines is extremely important in this field. What I would also like to say before finishing is that there is increasing need for rapid evidence in this space, and cohort studies take a long time, and some of our research takes a long time. So we need to also focus on methods and ways to produce evidence rapidly, to respond to environmental and natural disasters, to respond to disease outbreaks, which cannot wait. So we need to work collaboratively. We need to work to find ways and methodologies to respond quickly to environmental and other emergencies in this space. So I think that's also very important. And maybe finally also to say that, you know, in older times, we'll go to conference, we'll meet people face to face. So it's great to have these webinars, and good to meet online. And I hope, you know, soon we'll be able to meet in person again. And you know, it's the face to face contact and personal interaction is irreplaceable. Thank you.
And finally, Richard, some reflections from you.
Not much left for me to say, is there? I mean, the only things I'll say, just from my own point of view, is I agree with it with everything else. But I think, yeah, from my point of view, sitting in the health department, I think we really do value the relationships we have with research groups and researchers, and so that we want to build on that. And Sophie, don't feel afraid to try and get involved with us as well. And as I say, it's really like the collaboration between research and government can be fulfilling as well. So I'd encourage you to as much as possible.
If I could just jump back in as well. I'm sorry, I was actually just distracted before by Lucy's website, having a look over there. But and just exploring what we could use this for in our future research. It's really great, Lucy, by the way. So I'll be in contact. But yeah, this is a really exciting field, and I encourage everybody to go out there and see what's available and get familiar with the literature, as Jeff has made the point. I think there's a lot of areas for collaboration across the different fields, and I think it's going to be really exciting in the future as we recognise the utility of environmental health in all kinds of health research.
Thanks, Joe. And I'll just hand over now to Michael to thank everyone and to close the session.
Thank you all very much. Thanks to participants for your engagement with this webinar, and a special thanks to all of our panel members. I guess a couple of themes that seem to have come up again and again have been discussions of collaboration, and things are not always easy, as I think it was Melody that just said that, but also in my notes I have difficult but manageable. So I hope that's an encouraging note to end on to further the understanding and investigation into the evidence ecosystem, which I think was Ellie's term. Thank you all very, very much. It's been a great session. I've certainly learned a great deal, and look forward to seeing you in future in this field. If you have any queries about any aspect of this, this slide here has our contact details, and I'm sure we can help to put you in touch with others if you need further information. So thanks very much, and all the best.